Our first presenter tonight is Dr. Puneet Seth. He is the Chief Medical Officer at InputHealth Systems. Puneet is a family doctor who's unable to sit still while the technology available to healthcare providers lags behind every other industry in the world. Now on his third startup, he's Chief Medical Officer at InputHealth Systems, a company on a mission to connect patients and their care teams through a single, powerful, shared health record system. Tonight, Puneet will be speaking about carrying a moral compass in digital health. Welcome, Puneet.
Great. Thank you. Perfect. Thank you so much, Maggie, for that kind introduction. Thank you, everyone, for being here tonight. Thank you to HealthTO and JLabs. So I'm really excited to be here in front of everyone today to speak about a topic that I'm very passionate about. And that topic is ethics and morality. Cue chirping crickets. Jokes aside, or not funny jokes aside, when I talk about morality, I'm certainly not here to tell you guys about what's right or what's wrong. Rather, I'm here to talk to everyone about why it's important as a business to understand your own values as a company and how understanding those values can actually help propel your company and your product into the market. And what I'm hoping to be able to do is to talk to you about InputHealth's story and how we've succeeded in being able to do that. So a little bit about our journey as a company. So we started off in 2010, 2011 as a consulting company, and actually our story dates to before that as well. Damon Ramsey, our CEO and co-founder, and I went to medical school together at McMaster. Yay, McMaster again. And Damon met with our other co-founder, Sean Jung, a brilliant and gifted designer and developer. They moved into a basement in Pittsburgh and they started building apps. And the very first app that we built, which you can see over there, was actually a data collection app for emergency departments and trauma centers. So that worked out well, and what was obvious was that organizations across the board were really looking for the same thing, which is how do we have structured conversations with patients? How do health systems better talk to patients? And rather than having to build a separate app every single time, what we ended up doing was building the InputHealth Pro system, or our Q&A system, which basically provided that toolbox to an organization to say, you know what, you don't have to reinvent the wheel. You now have the control and the ability to build your own data collection questionnaires. And that worked out well. We pivoted again, seeing that patients and populations wanted more when they wanted to access care. They wanted to go beyond just questionnaires. They wanted to be able to request services online. They wanted to be able to share messages with their providers. And we built a patient engagement ecosystem. All of this culminated in our flagship product, which is the Collaborative Health Record. The Collaborative Health Record is a reimagining of what a health record system can be. Imagine a platform that actually makes the lives of clinicians easier. So how many people here are healthcare providers? Fantastic. So you guys know the pain that we feel when we think about EMRs and the frustration that results from how they actually tend to add more work rather than remove work from us. So we built this wonderful product. We understood that we have a pain point in the market, which is that there's antiquated health information systems, and we built a wonderful and fantastic team, many of which are here today. So is that all it takes to be able to bring a product into market and to be able to actually get organizations to use the platform? The answer is obviously not. And the reason is because healthcare, similar to other industries but unique in that there is a lot of risk aversion. Much of that risk aversion is rightfully gained because as healthcare providers, we don't want to inflict harm. Now, we can all think of examples that have been coming up in media with respect to health records and patient data popping up in different places, millions of records showing up in the United States. So you can imagine as healthcare providers, there's an aversion to want to use new platforms. So Damon and I, much like several of you here who are healthcare providers, took the Hippocratic Oath when we began medical school. First, do no harm. And we were inspired by that. And we thought, what if we could apply that same transparency and logic to our approach as a business? What if we could do no harm with data and with our systems? Inspired by that, we created the Informatics Oath. Very clear and simple language around the fact that we have no business trying to sell or share your data in untoward ways. We simply want to provide a service. And we know that as a company, but putting it out there, having that clarity and transparency builds trust. And trust is an extremely important thing when you talk about how you can actually put your product in front of organizations. So what did this trust result in? So several years ago, when the Mayo Clinic was looking for a platform to be able to collect outcome measurements, they took a leap of faith. They looked at these half a dozen young entrepreneurs in Canada and said, you know what, let's give you guys a try and see what you guys can do. Because there was an alignment between our values as a company, we were transparent about that and what they were looking for. Fast forward several years, we now are operating across 18 different clinical departments at the Mayo Clinic and across 3 of their main hospitals in the United States. Similarly, back in 2014, when the University of British Columbia was looking for a health record system for campus health, we came up to them and said, hey, we have this wonderful platform. But it was early, we didn't have a lot of traction at that point. But they were able to take that leap of faith because they felt there was transparency and integrity in what we were doing. So today, we now are proud to say that we have over 1,500 clinical users across this country that utilize the collaborative health record. We host over 3.5 million patient records in Canada, and we're now operating in the United States and in Australia and the United Kingdom as well. So the point here being is that your values do matter. When you're building a business, other than just thinking about the problem in the market or the technology or what type of innovation you're going to do, think about your actual values. And if you stand by your values and your values align with those of the people that you're trying to sell to, it makes all the difference. I'll also point out and say that values and trust are really hard to come by, and they're really easy to lose. So as you're growing your team, you need to make sure that those value systems are actually baked into the DNA of your company. Thank you.
Thanks, Puneet. Any questions? So if you have a question, just put up your hand and someone will come around with a mic.
So you've mentioned providers. What about corporate solutions? What about hospital systems? What about OHTs? What about larger customers that could potentially benefit from and scale your environment?
Absolutely. So that's a great point. Thanks so much, Duncan. So it's the same principle. I think health systems are really a scaled version of the work that individual healthcare providers are trying to do, and I think the trust that you need to build is extrapolated to those same organizations. So absolutely, as a platform and as a technology, we're completely ready to be able to address the needs of Ontario health teams, and we're excited at the opportunity to be able to do that.
Question over there.
Just on the question of values, just curious if you have a story or an experience when your values were challenged or otherwise you had to really gut check your own values. Usually that's sort of the value of the values, as it were. If you have an experience or any sort of story about that where you were faced with that challenge.
All day, every day. No, seriously though, it happens a lot, and I think as a growing business, you're beginning to make decisions that are bigger and often at a faster pace. And as a business, so we're a self-funded company. We've bootstrapped our way here. We took the long road. And often there's easy ways out. And sometimes there's ways in which you could say, well, those were our values of the past, and perhaps our values of the future can be different so that all of a sudden we can move more quickly into a space. So you're absolutely right. It becomes very important to remain clearly understanding about what your value system is, and that value system is shared with those on your team as well. That's a great question, Peter.
Perfect.